So your lead says, hey, I'll get back to you, and then they don't get back to you. Surprise, surprise. And then you start calling them, chasing them down. No bueno, you're losing sleep cases. So when the lead says, hey, I'll get back to you, you just say, yeah, I'd have to look at my schedule. Sometimes it might be a little hard randomly getting a hold of me like that with my schedule and with other patients. What I can do though, if it helps, is if you have your calendar handy, I can pull up mine and have you book a specific time with me. That way you don't have to chase me down and vice versa. Would that help you? Yeah, sure, that'd help me. Okay, great. And then what you want to do is you want to start negotiating on time. And now you have it on the calendar, and so do they. So now you actually have a reason to get with them. If you just let them control that, where they're gonna, quote unquote, get back to you, that puts your staff into chase mode, and you're lowering your status in the patient's mind, and you're very unlikely to ever close that case.